Well, hello, everybody. I hope everybody's doing good today. Can everybody hear me? I'm not sure. I'm not seeing any signs.
Yes.
Oh, okay. So sorry. I can't seem to put my my PowerPoint on there for some reason. So anyway, well, first of all, my name is Nellie Cordova, and today we are talking about what is a medical interpreter. Basically, with medical interpretation, I can tell you that it's come a long ways nowadays, and we are now doing a lot of certification in the nationally, and because of that, we are needing more interpreters everywhere. Of course, with medical interpretation, there's a lot that goes with that. First of all, I'll let you know that as medical interpreter, I am now certified nationally, and I am part of the board of directors as well for the National Certification Program. And I will tell you that a little bit about me. I was born in Brooklyn, New York. I've lived in Texas, Oklahoma, in California, and now Arkansas. So that's just a little bit about who I am. I've been around a lot. My parents are actually from Mexico, and they're one of them's from Mexico, the other one's from Chiapas. So yes, I speak Spanish very fluently. Not because I'm born there, but because I actually studied in Mexico and I studied here in the United States. So because of that, of course, I've been able to get a lot more of the interpretation in with the information that I'm getting. I will asking what is a medical interpreter. Again, medical interpreters, we go out to help people. We go to be able to communicate, enhance the communication, know the terminology, whether it's common or whether it's, medical terms. And basically what we do is we help people to be able to communicate. Now, I'm sure some of you speak 2 languages, right? Okay, so, but sometimes we try to help people, and we've noticed that sometimes with some of the terminology, it's very hard if you're not trained, if you don't know certain words and things. So it is very important for us to actually know or try to learn as far as what we need to know to help others. Medical interpreters, actually what we do, again, we do enhance the terminology, but when it comes to medical interpretation, we have to know the medical terms for different things. And there's a lot of different terminology that goes in play with that. It depends where you work. It depends what you do. I, for instance, actually work at Arkansas Children's Hospital full-time. So because I work in the hospital, I am everywhere. I interpret for absolutely every department. So if you walk in the hospital, the first thing you see is security. Yes, I can interpret for security if there's an issue with something. And then from there, they go to registration. In registration, I also can interpret. Registration terms, would be some of the forms that they fill out, with their address, name, and all that information. We also have financial counselors, which means I also have to know a little bit about billing, a little bit about finances, a little bit about, okay, what is your gross income and those kind of terms. Then from there, of course, that's more of the administration type of staff. And then we go into the clinical settings. We have clinics, we have pediatricians. Pediatricians are regular doctors that see little children. But then we also have specialties. We have all sorts of specialties. We have neurology, gastroenterology, pulmonology. So all the G's, right? A lot of different specialties that we deal with. Now with those specialties, actually, all of them have different terms. If you go to cardiology, it's all going to have to do with the heart. So you want to know your medical terms for that. Pulmonology, everything that has to do with your lungs, your respiratory system. And not only do you want to know the anatomy part, but you also need to know, if the therapist comes in, what kind of therapy is going to be given, like a PFT. What is a PFT? Pulmonary function test. And so there's a lot that goes in there. Those are the specialties. And then you have radiology department. Radiology, of course, is the ones that are going to do the x-rays, CAT scans, MRIs, and all that kind of stuff. So it's really exciting to go from one area to another area if you work in a hospital. If you work in a clinic, there's always exciting things too. As a matter of fact, that's how I got started. I started in a clinic. I started in Rogers Medical Center clinic. And basically, it was just regular doctors that people were seeing, adults were seeing. But we also have usually imaging, which is radiology, a little department there. They have ultrasound. And of course, there's a lot that goes in just a clinic. So you might want to specialize in a certain area, and that would be wonderful. Again, so one of the questions they asked me was, why did I become a medical interpreter? Well, actually, I became a medical interpreter when my son was born because he only weighed 1.5 pounds. Can you believe that? And he only measured about 10 inches long. So if you look at your sheet of paper, the length of your paper, that was the length of my child. So anyway, so he was tiny and he was in intensive care unit for 3 whole months. While he was in intensive care unit, I got to see a lot of parents that would come in and out to see their babies too. And while they were there, I noticed that a lot of them didn't speak the language, didn't know English. And this was in California, and there was no nurses, especially in the night shift, there was no nurses that spoke Spanish. So it was very difficult. And during the entire time, there's always going to be something that happens. I actually got to see a 3-week-old baby that had a heart attack. And when that happened, of course, everything goes chaotic, right? Everybody rushes to go save the baby. But during all that, the parents didn't know what was going on. So I knew English and Spanish, and I just went ahead and jumped in and I told the nurses, hey, can I help you? Can I help the mom and dad? Because they're all like, nobody knows what's going on. So that's where I decided, after seeing so many things going on in the NICU and intensive care unit, I decided, you know what, this is what I want. Excuse me. This is what I want to do. I want to be able to interpret. I want to be able to help other people. And that's where it all started. So, and I started looking for, where can I actually study to become a medical interpreter? And started from there, and I started working at a clinic after my certificate program. So that was the reason I started. I think everybody has to have a reason, a motive, or a passion as to why you want to do something. So it's very important to find out where your passion is. What are your skills? What are the things that you like to do and you can do and you feel capable in learning more about? Medical interpreter, in order to become a medical interpreter, you have to take a course. In order to take the course, before then, you have to be 18 years of age, okay? You do have to speak 2 languages fluently. In other words, you're not gonna go to an English class or Spanish class because you're gonna go into a medical terminology class. But you are going to be able to get that information that you need. So you need to be 18, you need to have your, whether you graduate, okay, you want to graduate from high school, have your diploma, or you can also actually go if you have a GED. And that actually helps us prove that you went to school, that you know English, okay? And you have to have some kind of proof of a second language. So if you're in high school and you're taking another language, whether it's Spanish, Marshallese, or whatever language you're taking, those courses can actually count for you as for the certification as well. So you take those, And once you get done with that, then you can actually take a certificate class. A certificate class is actually a 40 to 45-hour course. And basically, that's the courses that Cordova Educational Programs, which is me and my husband, we actually do those trainings here in Arkansas. And there's other facilities that you could probably log into, online classes and things like that. So this is something that I'm looking forward to being able to, in the future, offer to high school students. Right now, we're working on that, because that way, when you get done with your high school, hopefully, I don't know when your birthday is, but when you're 18 years of age and you have already the class or the training for certificate program, at age 18, you can actually take the certification and then you become nationally certified. Let me tell you, becoming nationally certified is awesome. It goes a long ways. The certificate program also helps out as far as being able to work in a facility, in any facility. Now, where can you work with this? You can work in any type of medical place, okay? A lot of people now are looking for professional bilingual staff. So when they're looking for bilingual staff and you have the certificate that you took medical interpretation and you know fluently 2 languages, you are like top of the list to be able to get a job. You could go work not only in a hospital, in a clinic, but you can work in different places. Like there's therapy centers. I'm sure some of you know there's physical therapy, occupational therapy, speech therapy, and there's even behavior therapy, which is already going into the mental health also. Working with a psychiatrist, with a psychologist. You could work in a pharmacy. Actually, I became a pharmacy tech while I was working for a pharmacy as well. All those certificate programs will really help you on the long run. And they're short courses, but they really count. They add up on the long run. So there's, like I said, there's lots of different places. Now, there's also even dental if you don't want medical. If you work with a dentist, those courses count for all that. So anything that has to do with medicine of any part of the body actually will help you to be able to get a better salary, to get a better pay rate and all that. Benefits, no matter where you work, a lot of the medical facilities, organizations, they all have all sorts of benefits. So we're talking about anything from health insurance, life insurance. You're talking about even pay for your schooling. If you decide that you want to continue studying, whether it's nursing or getting a tech license or even be a doctor. I have some students that it's been a while. I've been teaching for 17 years. So I have some students that have become nurse practitioners. And one of them is about to become a doctor. And I'm very proud of them because it took them quite a while to get there. But through becoming a medical interpreter, they were able to work and they were able to get funding through their facility, their organizations, to help them pay for a lot of their schooling as well. So there's a lot of ways to move up the ladder in the medical field. And I think that's very important. As far as personal qualities, it's very important to not only know the languages. It is important, of course, to know the languages, but you also have to have the heart to be able to be in that area that you want to be working in. Everybody has, like I said, different passions, different qualifications, different, we all have different personalities, but you have to remember that when you're dealing with anybody, any patient of any sort, you are going to get lots of different people. And between all those people, you're actually going to be able to interact with them. And especially if you're communicating, you are constantly communicating. You're constantly in contact with the patient and with, the physician or the staff, whoever you're interpreting. So pretty much you have to have a very good attitude with absolutely everybody and everything, because you never know what comes up. There are situations where I'll have something that was in the emergency room that was something very critical. And then from there, then I go to another patient that was, something with exciting news, something good happened. And you have to be able to retain your emotions, be sensitive to every single circumstance and every single um, treatment or patient that you see. So it takes a lot out of a person. It is more an emotional type rather than a physical. Physical, basically, I have to work everywhere in the hospital, so I walk a lot, I stand a lot. But besides that, it's more, I think, emotionally than anything else as far as that's concerned. So like I was saying, the day pretty much goes really quick. The more patients I see, the faster it goes. Right now, like the emergency rooms are pretty full, so I see a lot of that coming around. And talking about salary, as far as salary is concerned, the base salary here in Arkansas right now is it's about $22 to start out with. Now, if you have only your certificate, of course, that is a base salary of about $16 an hour. They like for you to have the certificate because, of course, they're knowing that you are proficient in both languages. So you'll start about 16, 17. It just depends what organization, what facility is hiring you. If you can find a facility that has to do with the state, like UAMS, those facilities usually pay a lot better, simply because they're state, or depending, like I said, depending where you're going to be working at. Also, remember that every time you get a certificate of any kind of program, for instance, if you're going to work in a pharmacy and they're hiring you, let's say they're going to pay you base pay about $17 or $18 an hour, then they're going to actually increase you if you decide, hey, I want to be a pharmacy tech. And while you're working there, a lot of times you can get that easily. I got that within a year, and your pay increases as well. Almost, I don't think there's no medical facility that does not have benefits. And so pretty much everybody's going to have different types of benefits, like I was saying earlier. And a lot of them help pay for those other certificate programs as well. So before I continue talking so much, we talked about the base pay. So anywhere between 22, right now, the state of Arkansas, I can safely say that we're at about the most I know is being paid here is $44 an hour, which is quite a bit if you look at what you're talking about, with difference of facilities and how much the pay is. It can go pretty high. Department of Human Services, actually DHS, is one of the ones that pays the highest. And the reason they pay the highest is because a lot of them are commuters, are actually interpreters that have to go like to the houses to do visitations with their doctors, nurse practitioners, or, to see the patients at their houses. So because of that, the pay, of course, is a lot more. And the scheduling could be a little variant as far as that's concerned as well. Now, if you work night shift in the hospital, of course, your pay is going to be more than if you're working daytime. Or if you're working 12-hour shifts. Right now, on and off, I work 12 to 13-hour shifts, and that also increases your pay. Well, I think I've said a lot already. I don't know if there's any questions from anybody, if anybody has anything they'd like to know. Remember that if you don't ask, you won't know. So any question that anybody would have?
I wrote some down for you.
Okay.
What was my first one? I had some things, I had a lot. How long is the certification program?
Okay, the certification, once you get your 45-hour program certificate, that usually takes about anywhere from 10 to 12 weeks. And once you get that certificate program, you can apply for the certification. Now for the certification, there's 2 organizations. And I will be sending you all that information. Like I said, I couldn't pull up my PowerPoint, but I'll send you all that. And in the certification program, actually, there's 2 organizations. There's CCHI and there's NBCMI. Both of them have the same requirements, but the NBCMI actually has 2 different tests. They have one that is the written test, and then they have an oral test. And after those exams, you have to wait, I believe it's 3 months after the first one to actually take the second one. And you have to pass both of them in order to get your certification. It's written and oral. That's why my classes are actually both. They're written and oral, to where I record all my students. They're all verbally interpreting everything that I say, type of thing. So because of that, I generally tell them to take the NBCMI testing. And the CCHI, that one is actually a test in itself. It's about, I want to say it's about an hour and a half long. A lot of people like that one because it's multiple choice, but at the same time, that one only, I believe that for that one, it's only the written part. I don't know if there's any oral part on that one, but both of them, the CCHI, that one you do it at one time. And the only thing with them is that you have to go to the locations that they have. The nearest one from here is in Memphis, Tennessee. And so, but for the national, the other one, NBCMI, National Board of Medical Interpreter Certification, for that one, you can actually take it online. And you can take it, they just request that you be in a private room somewhere. They have a proctor, they'll ask you to see the whole room. You can't have anything with you, that kind of thing. But you can take that online. Mm-hmm.
We have one in the chat. Are interpreters present during an actual surgery?
During an actual surgery, you're not interpreting for anybody because nobody can go in with you. No, but it's what's really interesting. It depends where you work. After a while that you're working there, like, okay, so I'm really old, right? Because I've done this for 17 years. Actually, I've interpreted for 20 years. But anyway, so interpreting with doctors and getting to know the doctors, once you build that relationship with the doctors, it's so cool because some doctors will say, hey, if you ever want to go in, you can go in. That's and fun. So, yeah, I know everybody wants to see a surgery or something, right? But you'd be surprised. In the emergency room, I see a lot of things that go on in there because, somebody will come in and it's an emergency, something going on and fractured bones, that are open wounds, and things like that. So you see a lot of exciting stuff in the emergency room.
Do you need a medical degree of any kind to do your job, or does it help if you have a medical degree?
Well, actually, I have a lot of people that I do not have a medical degree. I started studying for psychology and I have 3 years of that. So of course it's going to help you on the long run because your pay increases quite a bit. But like at when I'm teaching my courses, actually, I do have nurses. I've had 2 doctors that have taken the course simply because they needed to have that proficiency in order to back them up when they're actually talking in Spanish or English, going back and forth with their patient. Not that they're interpreting for someone else, but when you look at the liabilities that can happen, that when somebody says, I speak Spanish, and you go in a room and you tell a person, you know, okay, you're going to have this surgery or a consent form or whatever, and you're not saying the things the way they really are, then there could be a liability suit. And you're talking about going to court, losing your license, and that's the end of that. Okay, I know it stinks, but that's anybody, and you know it. I mean, recently there was this nurse, right, that everybody saw on TV that had gotten charged and all this stuff that went on with her.
Oh, yes. Yes, I
Okay.
remember this.
Right. Well, you know, that's so funny that they showed that case on TV, because there is a lot of cases going on all the time. And there's a lot of other things going on that we don't see that, but they just happen to focus on her on that issue. But there are a lot of doctors that, yeah, you can get sued for so many different things, nurses and stuff. So as far as the language is concerned, this really helps them. This really backs them up and says, hey, I am proficient. I know what I'm saying. And if you were to go to court, there are interpreters that end up going to court, because they will ask us, you know, like, okay, so you said, you told this person this, you know, did you say this, you know, examples. And it's so funny because sometimes people don't understand. Like there was a court case, I will tell you, of an interpreter who actually was interpreting for a dad who was trying to keep custody of his child. And they asked him, do you ever take your child to play football? And the interpreter said, llevas a tu niño a jugar fútbol? And the father said, no. Well, because of certain things, and not only that, it proved that dad was not taking time with him. But then after everything was done with, he ended up talking to his attorney, and he goes, I can't believe this was an assumption because I said I didn't play football with him. Instead of them asking, do you play soccer with your child, which this father did, and he misunderstood the question as football, American football, and not soccer, Spanish, you know, that makes a huge difference in the court. And they can take it anywhere they want. So it's something very important. We take things lightly sometimes. You know, one of my very first classes with everybody is, okay, when you speak to someone and you say, let me introduce myself, okay? In Spanish, you don't say, me voy a introducir. You say, me voy a presentar. Why? Because introducir in Spanish literally means to introduce something, to insert something. And I'm not going to insert myself. So, yeah. So if you catch my drift, right?
Oh,
You're
yeah.
not going to say that. Nobody's going to say that in Spanish, right? Okay. No me voy a introducir, me voy a presentar. I'm going to present myself. Okay. All right. So we'll keep it that. There's a lot of different things, you know, that interpretation can be taken one way or another. But then also interpretation also means everything that's being said, I'm saying it exactly like you are, which means it's not literal, but it's the meaning that counts. Okay. And you have to use the same tone and register as the person speaking. Because if a doctor says, I don't, let's say, take this medication, but do not take any aspirin with it. And I say it in Spanish, right? But I'm saying, tome este medicamento, pero no tome aspirina. So if I put it that way, the person's not getting the stress on, don't take it with aspirin, right? So you have to use the same tone and register. So there's a lot that goes into it.
We have another one in the chat. It says, do interpreters generally work at one hospital?
No, interpreters can work anywhere. You can work at any hospitals. There was a while that I was actually working for Arkansas Children, and at the same time, I was working with hospice, which is end of life. It was Circle of Life. Actually, with them, I was working, but I was then again volunteering time with them. So you can work anywhere. work with Mercy Health Systems also, because I train their interpreters and things. So you can work anywhere. You could have 2 jobs if you wanted to. And it doesn't have to be 2 hospitals. It could be 1 hospital, 1, clinic or whatever.
If one wanted to enhance their pay beyond medical interpretation, what career would work well with interpretation, and what might be the next step?
Well, we like to talk a lot. Actually, we have a Marshallese interpreter. He is so awesome at Marshallese, and he is also a DJ on the radio station. So like I said, he likes to talk, right?
That's cool.
Yeah. And we have a Spanish interpreter who on the side, well, he's a DJ on the radio, the Marshallese, but the other Spanish interpreter is actually a DJ on his own. He goes around and he DJs parties and things like that. So it's interesting. Like with me, basically I interpret, but I also teach. That's my other heart. I love to teach. So you could be a teacher, you could be, I don't know, there's so many different things that you could do. There's a interpreter that I know that's not only an interpreter, but she's also a social worker. Her main job is social worker, but then she also interprets in the evenings for, some of the free clinics in the area. So you could combine it any way. It just depends on your passions. It doesn't have to be, talking and things like that. There's an interpreter that's in Phoenix, Arizona, and her main thing is medical interpreter, but she also likes to paint. So she's a professional painter. And you're talking about not canvas, but she likes to paint houses. So it's kind of interesting, but yeah, anybody can choose any job.
Is there a large need for interpreters right now? Like in the medical field or otherwise?
Right. Well, yes, there is, very much so. I'm sure everybody has seen the news, how many immigrants are coming in to the States. And not only that, but also one thing is that we see that the numbers of people coming in, but then when you also look at businesses, if you're a business major, sometimes you want to look into interpretation as well, even in businesses. And the reason for that is because a lot of the businesses that the United States is doing has to do with the rest of the countries. And so one of the big ones right now is China. I mean, if you look at all that they import, export, and all that kind of things, and then you have all the other different countries that also export, import here. So interpreters are very crucial anywhere and around the world. So even the more languages you know, the more languages you speak, even the better for you too. That could help with that. But as far as medical interpreters are concerned, the numbers are growing rapidly, especially because there is so much that involves code of ethics, HIPAA, confidentiality, and all that, that it's no longer where just anybody can come in the clinic and interpret. Like before, they could get their neighbor, get anybody else. Now we have to make sure that everything is, under legal or liability standards. So it's very important to know that, yes, we need a lot of interpreters. And as a matter of fact, right now, one thing that's very, very accommodating for a lot of medical interpreters is that we actually have a lot of organizations that are doing it by camera. And I'm sure you all have heard of telemed. Telemed is actually through television or through, they're watching you through video and they're interpreting for you. So it's so much easier to sit at home, interpret on camera, and you can jump from doctor to doctor to specialty or however you want, depending on how many contracts you want. And that's a lot of people are starting to do that. So that's another thing.
The medical field requires a great deal of education as it is. If one wants to join the medical field, but not necessarily as an interpreter, would you recommend a student study a second language? And if so, is Spanish the most desirable?
Well, actually, I would say yes. If
For
you're
our
looking
area?
at your area,
For our area, is Spanish the most?
yeah. Well, the prominent language right now is Spanish. If you look at if you look at the industries that are around us, or the organizations or the companies that are around us, most of them are actually requiring a lot of, how would I say, depending on the kind of work, I guess, in the area. It depends what kind of people are coming in our areas. And so it's very important for actually having interpreters also, but not necessarily like you were saying, you know, just speaking another language is so, so important in any kind of business right now. But yes, Hispanics are on the huge influx the past, what is it, 20 years in our area. I think they were saying it's almost like a 70% increase of how many Hispanics are coming in the area. And it's funny because the other number, of course, Marshallese is another one, because this is actually their center, you know, home, I guess you might want to say it. Arkansas has become where almost all Marshallese are coming. You won't find them like in other states. But also the other number that's growing right now is Asian. So we have, and that seems to be more because of like companies like Walmart, you know, and them that are bringing a lot more. We're becoming a little bit more, we're no longer rural everywhere. You know, these cities are growing so much that we're expanding quite a bit. So
if a student was to join the medical field, do you think it would benefit them to study a second language? And not necessarily
yes,
be an interpreter, but just have that.
right. Have that with them.
Isn't there?
That would be, yes, that would help them so very much. You don't have to be a professional interpreter. You could be, as a matter of fact, I work with Arkansas children, and everybody in that building is required that if you are bilingual, you have to take at least a certificate, or you have to take a test simply to find out that you are proficient in bilingual in order to do certain things in the hospital. You cannot just interpret for everybody. Now, people that are bilingual, of course, they could do simple things, you know, like if they're volunteering, or, you know, asking a patient, do you need a pillow? Do you need this? Or whatever, are you comfortable?
But you need that certification for the medical.
To speak medical, okay. Right. Mm-hmm. So, and that is something that the state is looking into already, about possibly making this, I don't want to say a law or anything like that, but a requirement for all medical facilities to have everybody trained. If possible, and that's why a lot of organizations are paying for it. Mercy Health Systems, actually, that is one of the reasons that I train with them, is because they want everybody trained. And so if you're going to be speaking to a patient medically and try to interpret for any professional, you have to have a certificate. So that's the reason that they have to take my course. But what's nice is that Mercy pays for it. And not only do they pay for it, they also give, I believe they get a 10% raise for taking the course and passing it. So, hey, who doesn't want to pass a course, you know, get 10% raise just like that.
Right. Okay,
right.
I have another question. Do veterinarians use interpreters? Do you know?
Yes, they do. As a matter of fact, there's one vet here that got on the roll, and he has got like half his staff that is bilingual. And you got to remember, I mean, it's not just English people that have pets. He was telling me that the majority of his patients or patients, right? Their patient parents are actually Spanish speaking. So
Cool.
yeah, he said, yeah, I could say certain things, but I had to get medical interpreters that were trained here.
Mhm.
So, and you know, a pet is well, like to me, a pet is actually very important. It's
Like
part of
your
the
child.
family. It's a pet, part of the family. Yeah. So as a matter of fact, that's who I'm battling with right now. Winter. Come here. Anyway, so, but yeah, it's one of those things that you want to make sure, you know, it's just like your baby, your children, that you want to make sure that everybody is good, right? And healthy. So this
Oh
is
my
this
God.
is winter.
Oh my
Oh,
God.
I'm sorry.
No, my kids love it.
Yeah. Okay. Yeah, that's
Okay,
winter.
we have time for a couple of more questions. Is
Okay.
there a limit to how many interpreters a hospital can have? And is the work, for example, on a case-by-case basis, or is one hired to work full-time?
Actually, you can have a contract if you want with a facility like DHS. You can work in the facility full-time. They have full-time positions, but then they also have for contract. And contract, those are, you can tell them, you know, okay, I'm only going to work these hours or these days. And they just call you or they text you or they send you messages. These are the patients we have. These are the times we have. Although most of those under contract are going to be like outside of the facility where you're commuting. So of course you get paid for your miles, but you get paid for also interpreting for them. And as far as other facilities, most of them like to have full time. So I know our facility, actually, we have a full time, but we also have part-time, what we call PRN. Those are people that come in whenever another interpreter is out, that person's going to come in for us. Or if I'm vacation or whatever, that person substitutes my place. So it just depends which way.
I like this last question because we do the seal of biliteracy here. So would the Arkansas seal of biliteracy certificate or the global seal of biliteracy be sufficient proof for being bilingual? Or would you still need to take the certification that you did?
You know, I had not come across that question. That would be something I would have to call and ask the national certification, and I can get you that answer. And it's interesting that you come up with that because my daughter has that.
We have a couple of kids. Did y'all take it? Y'all already took it. Did you get your results back yet? No. They all passed, so they have it. So.
That's awesome.
Okay, well, I think I might have to ask about that. I might have to get, you might have to tell me about that later. But okay, final question since it's 9:50.
Yes.
Would you share your favorite story or most rewarding experience from your time interpreting? If you can pick one.
If I can pick one, oh my gosh, there's so many. Okay, so this couple had been wanting to have a baby so bad, you know, and they had gone through so many different therapies and stuff. And I mean, the mom was like so devastated, you know, she would cry every Mother's Day and stuff. So then it just so happened that with some of the new therapy or the new procedure that they did to her, she was able to conceive. And it had been approximately 10 years since they had wanted a child. And it was funny because they had just signed for an adoption to adopt a child when she found out she was pregnant. And so, of course, we see them, you know, every month. We wanted to make sure everything was fine. But before confirming, just to confirm, on the second month, they were doing the ultrasound. Bless you.
Thanks.
And as we're doing the ultrasound, I'm interpreting for the parents, right? Okay, we're monitoring right now. It was actually the third month. And they were monitoring just, okay, yes, there is a heartbeat already. There's this, you know, it's still growing and all that. But the doctor said, well, hold on a second. And the mom's like, oh no, don't tell me bad news, right? And he goes, well, hold on a second. So he kept on looking. And of course, mom's getting worried. I'm getting anxious too, because I'm interpreting for mom. And then all of a sudden he goes, okay, I want you to look at this picture. See these 3 little bags in there? Oh, yes, they were going
3?
to have triplets.
Oh my God. Plus another kid that they're adopting? Oh my gosh.
Yeah, well, they actually went back. They did adopt the child, but they kind of put that on hold
Right.
a little bit. But yeah, they said we had already decided we were adopting you, but we got to wait a little bit. So, and they did adopt him,
That's
but
awesome. They
he
came to
actually
term.
had-
All 3 kids came to term.
so yeah, so she
Oh
had
my
4 kids at once.
God. Huh.
But
That's
that was very exciting.
awesome. That's
Yeah.
amazing.
Yeah, that's awesome.
Well, I don't think we have any more questions. I think this is our time, right? Yes, we have met our time limit. Thank you so much for coming to talk to us.
Oh, you're very welcome.
Tell her thank you.
Oh, you're welcome.
It was nice talking to you.
They look so warm over there in the corner, right?
Yeah.
Hey, Winter, want to say bye? Come here.
Oh my gosh, guys, look at her dog.
Come here. Come here.
Maybe.
She's looking at me like, what?
Oh my God.
Say bye, guys. She's a great Pyrenees.
Oh, those dogs are so good.
They're huge. All right. Thank you, guys.
Thank
Have
you
a great
so
day.
much.
Bye-bye.
Bye. Thank you. I think